Hello, my name is Jillian Coleman and I am your host for Tinker Talks, a new podcast that touches on all things Tinker. So today we met with 72nd Medical Group Commander Colonel Jennifer Trinkle to discuss the substantive changes affecting all TRICARE participants. So we know that this is a really big, all-encompassing change that affects all of our dependents, retirees, airmen. Before we get into the nitty-gritty of all of that, can you give us a little bit of a background on who you are and what your job is here?
Okay. I grew up in upstate New York. I actually put myself through nursing school and ended up becoming a open heart critical care ICU nurse at a hospital in upstate Pennsylvania. That's where I actually met my husband, and he was the EMS helicopter pilot at the time, so he would bring patients into the ICU. That's kind of how we met.
Okay.
And I actually worked in this hospital for about 2 years. And of course, you know, everything is not what it seems or what you would like. And my husband, who was a former Army pilot, thought I needed some different choices in my life, or different options, I should say. So one day he said he was bringing home a fellow military member that he knew for dinner. And so I came home that night, walked into my front door, and there was a guy sitting in blue with stripes on his shirt sitting on my couch. I said, "Hey, I'm Jennifer Trinkle." And he's like, "I'm Randy Smith, and I'm your Air Force recruiter." And needless to say, after a lot of discussion and going back and forth, we decided that we would try going into the military. And that was back in November of 1994, I believe. So first base of assignment was Lackland Air Force Base.
Okay.
I had actually asked my recruiter to give me a smaller ICU because I was working in a 36-bed open heart cardiothoracic ICU. And to his credit, he did give me a smaller ICU because the cardiothoracic ICU at Wilford Hall at the time was only 7 beds, but he negated to tell me there were like 8 to 9 ICUs.
Right.
Which I ended up not going to the cardiothoracic ICU. I ended up going to the trauma ICU, but it was a good thing because at that time we were just coming up with the concept of critical care air transport teams. So I was able to be one of the first critical care air transport team nurses.
How cool.
Yeah.
Have you kind of bounced around to a lot of different bases, or have you been stationed, overseas or anything like that, or?
Well, it's funny you mentioned that. It seems like I bounce all over the place. I came in as a critical care nurse, then became a flight nurse as well,
Okay.
and then a clinic nurse. So my assignments have been all over the place. I have had numerous bases, CONUS. I've been to Travis, Moody, Robbins. Been overseas to both Ramstein, Yokota, Okinawa. And it just seems that I keep rotating between the ICU, command now, and then kind of like other jobs in my Air Force career. So, I mean, I've had a fantastic career. I wouldn't change a minute.
It's amazing. So you've been at Tinker for, 5 months now? Did you come in June? Is that right?
5 months, yes.
So tell us a little bit about your role here as the Med Group Commander.
Well, as the medical group commander here for this facility, it is kind of the same as being a CEO in a hospital downtown. It's dealing a lot with the different MAGCOMs, the different entities, the higher headquarters, ensuring policies being delivered at the lowest possible level, and guiding and mentoring 4 squadron commanders to ensure that we deliver trusted care to our patients.
Mm-hmm. It's quite the task.
It can be some days.
Yeah. But, big challenges like that you're familiar with, all of this changes within TRICARE. You could say that's kind of like a Goliath in itself. So it could be intimidating, but you don't want that to be the message that is portrayed to everybody. So what are some of the big things that you can sum up for people to kind of put it in an easy to understand format?
Well, I think the easiest way to put it with Defense Health Agency coming in is that they're going to start running the business practices. We take care of a variety of patients here. We have retirees, active duty, and active duty dependents. And notice I don't say Air Force dependents or Air Force active duty. We take care of everybody, Navy, Army, Marines, anybody that walks through our front door that is eligible. And so if you think about it, care should be the same here as it is at a Army hospital or an Army clinic or a Navy clinic. And really, that's what this is about. It's about delivering trusted care and the best care that we can to all of our beneficiaries. So with Defense Health Agency coming in, what they're doing is they're going to assume the administrative oversight of the business practices, which is a good thing, actually. When we go to war, all of us into theater, we all have to take care of our patients together, very unified. That's what really saves patients. So it's no different back here. So what we really needed to do was to, one, get our budget under control because, we're about 10% of the Department of Defense budget, all of the medical entities together. And to do that, we need to do the same thing everywhere. When you do that, you cut costs. Now, a lot of people may say, well, what's going to happen to me? How is this going to affect me? It's not. You're still going to get the same care. You're still going to come to our pharmacy and get your meds. You're still going to get x-rays and labs. We're still going to take care of patients in this clinic. We're just going to do a few things different in how we deliver that care. For instance, one of the new things that DHA has rolled out is not having a clinic closed any more than 72 hours. So for the vast majority of our holiday season, when we have family days here on Tinker Air Force Base, we're actually going to run urgent care in our clinic.
Oh, that's nice.
So they won't have to go down to the local urgent care. They can come here. But it will only be for urgent care. We won't be open for everything else. But these are some of the initiatives that we are doing to ensure we're taking care of our patients. So some other things are coming down the line as well. And, of course, the biggest one, I guess, that's out there right now is the FedVIP.
Yes.
The Federal Eye, Vision, Dental Plan that is coming. So part of that was to standardize, one, for costs. But two, this gives our patients better options for their health care. One of the big things I think we need to remember is that when we are looking at these plans and this process, you really have to understand the health care that you need for your family. So you really do have to, what they call, take command of your health care and educate yourself. One of the big things that you can do right now is use the benefits website that's out there. And that actually is, it's TRICARE.benefeds.com.
Okay.
And if you go there and sign into that website, it will kind of walk you through some of the plans that are out there, both for eye and dental. Unfortunately, this is on the member to actually go and do this. So you got to do a little research, and especially, figure out what's best for your family. We have been, go ahead, I'm sorry.
When is all of this really kicking off? I mean, you always hear about open season and that kind of being the only eligible time that you can make these changes unless you have a qualifying life event. So you talk about these federal vision and dental plans, but you can't change that anytime throughout the year. You only have a certain amount of time to do it.
So from the 12th of November of this year to the 10th of December of this year, the open season will begin.
Okay.
And that is where you go out to TRICARE.benefeds.com and actually sign in there. You will actually be able to purchase a plan.
Okay.
Or, sign up for a plan. So it's very important that we educate folks about what this requires, especially for our retiree population, which is going to be affected the most. Okay. For our retirees, it's going to be both the vision and the dental. And they really need to understand their health care, in particular, of how much they need, especially for the dental plans.
Right.
Some person or one person or patient might only need annual cleaning because they have really great teeth. The next person might need a lot of crowns, so you're going to want a more robust plan.
Right.
The vision plans are also for the retirees, but they do pertain to our dependents, active duty dependents. So they can choose to go and sign up for a vision plan. They don't have to. They might not want to. They may have really good eyes and not need it this year, so you no need to sign up. But if you have a big family and lots of kids that wear glasses, it might be a benefit. So it's open to them as well.
Okay. And so you have all of these plans to choose from, whether it's just choosing for yourself, whether it's choosing for you and a dependent, if it's a family that you're going for. So that could be pretty overwhelming. And do you have options in terms of, like, there's the federal side that you can look at it, or the Tinker side that things are being done here? I know you guys have done town halls here, and there's been different resources available to those people on base, so they don't have to rely on all of the federal websites or hotlines or things like that where they can look at frequently asked questions. They can get all of that right here at Tinker.
That's correct. Actually, we've done 2 TRICARE town halls now with an emphasis on the federal eye and vision or dental plans. So we had a lot of great questions come out of that, and actually we taped those, and those actually can be accessed at our website. If you go to AFMS-Tinker-72nd Medical Group, you can actually view those videos. They're still available for you to view. And one of the other things that came out of these 2 TRICARE town halls is there was a lot of people that had concern. Our older retiree population who are not as computer savvy. So what we did is we actually got together with some of the spouses, and they wanted to launch a volunteer kind of work group or helping group for folks that may not be so computer savvy.
Okay.
So in November and December, there's a couple of dates that they are actually going to open up kind of like a work center over at the Burger King here on base in the Wi-Fi lounge, set up some computers, and actually help folks walk through that process.
Okay.
I have the dates. They're Tuesday the 13th from 2 p.m. to 5 p.m., Wednesday the 14th of November from 10 a.m. to 12 p.m., Tuesday the 27th of November from 2 p.m. to 5 p.m., 29th of November, 5 p.m. to 7:30 p.m., the 4th of December from 2 p.m. to 5 p.m., the 6th of December from 5 p.m. to 7:30 p.m., the 8th of December, which is 10:30 a.m. to 2 p.m., and Monday the 10th of December from 2 p.m. to 7 p.m.
That sounds like it would really be an important tool for so many people that maybe aren't super technologically savvy, but also they may just have questions. So is this a place where they could get those questions answered? Is it going to be TRICARE or medical group volunteers, or is it just any kind of volunteer that's helping them more from a technological standpoint and helping them kind of go through web navigation rather than questions and answers for TRICARE specifically?
Well, it won't be members from the medical group.
Okay.
As members of the medical group, we cannot support one plan or another.
Sure.
So to ensure that my airmen are taken care of, we did not have any of the med group people volunteer. This is all being done by spouses and retirees who are volunteering their time to come to this work area to kind of help people out. Frank Trinkle, my husband, was the one that actually launched this idea, and he has been diving into the website and learning all he can. He's been calling a lot of the companies. He's been calling TRICARE, getting a lot of the answers to a lot of people's questions. And he felt very passionate about ensuring that we were taking care of the folks here on Tinker Air Force Base. So we set it up, we worked it through AFES, and we are hoping that we get a good turnout.
I would imagine so. I mean, and I think it speaks just to the testament of the people here that are really trying to make sure that everyone gets that quality care, that no one goes, because some people may just not even know that the changes are so significant, or, and so it's like everyone is maintaining that wingman idea that you've got to look out for one another, and that goes all the way to healthcare. So that's really important. We've kind of talked about some of the places where you can access this information. So you've given the sites for Air Force Medical Service and the 72nd Med Group Facebook page. But do those places have like a one-stop shop kind of document? I imagine you'll post the times for the Burger King on that as well, but can everyone get all of their information, whether it's through links or FAQs? They can all access that on those sites, correct?
Absolutely.
Okay.
Absolutely.
What else would you tell people that have questions?
When the open season launches, there is supposed to also be a 1-800 number that you should be able to call. So feel free to call that number when it shows up on the website. But, definitely come out to the working group at the Burger King, ask questions. We won't probably have another TRICARE Town Hall until February. But you can always come into the information desk here, and our TRICARE folks in their offices are more than happy to answer any questions that you have.
That's awesome. So it sounds like town halls are becoming a big thing just under the med group, under your guidance, which seems to be a helpful resource for everybody. Is that important to you to get all of that feedback to really know how to go forward?
Well, from starting here on day one, my biggest thing has been communication. Communication and education of our patients and our staff. This was just a natural development in that communication link. There are so many different generations we have that service our medical group, from patients that are literally 90 years old to even our youngest, which are newborns. And each of these different generations accesses communication and information in a very different way. A lot of our young folks are very techno-savvy and, are very instant information on social media pages. Where our older retirees, they rely more on, what they call snail mail, or having the old-time TRICARE town halls where they come and they socialize and they talk. So we want to make sure that we hit every gamut with the information that's coming out, because healthcare is a very important asset to anybody.
Absolutely.
So we want to make sure that we are delivering trusted care. And to do that is to deliver good information and to communicate with our patients, whatever way they feel comfortable with.
And being in public affairs, we totally experience the same thing. You have all kinds of ranges of audiences, and you want to target them in whichever way they best receive that information or understand it. So I applaud you for doing all of those different things. And you've really kind of condensed a huge topic into pretty concise information, and you've taken out all of the medical jargon and insurance jargon that people can kind of get overwhelmed with. So we appreciate you taking the time to sit down with us. Is there anything else you would like to add before we close out?
No, I want to thank all of the healthcare providers and people at the Med Group for being so supportive of all these initiatives and really embracing it to take care of our patients. We look forward to talking more in future town halls and through social media with our patient population.
Well, thank you. Thank you all for tuning in. What do you want to know? What do you want to talk about? Who do you want to hear from? We want to hear what you think. So find us on social media. Follow us on the web at Tinker Air Force Base.